Hello, welcome to our presentation, Community and Cultural Connectivity, Equitable Approaches to Shifting Health Ambassadors to Virtual Programming. Next slide. My name is Ana Olaños, Chief of California SNAP-Ed Program, known now as CalFresh Healthy Living. This session will highlight the work of two community-based organization pilot projects that focus on intergenerational health ambassador initiatives engaging Latinx and tribal communities. These community-based organization pilot projects were intended to showcase cultural adaptations to currently approved SNAP-Ed strategies such as youth-led participatory action research with intergenerational indigenous communities focused on food sovereignty and a capacity building and leadership training for policy systems and environmental PSC change focused on healthy eating and active living for Latinx communities. The learning objectives for today's presentations are understanding effective community engagement strategies for advancing SNAP-Ed policy systems and environmental changes using adaptive strategies during public health emergencies, and how we were able to identify culturally appropriate approaches for SNAP community engagement efforts in virtual settings. Next slide. In 2017, CDSS provided the Public Health Institute Center for Wellness and Nutrition with the opportunity to seek qualified subcontractors to develop strategies and to pilot community-led projects that addressed healthy food access and food security. These pilot projects are community-based organization projects focused on Native Americans, early childhood education, summer meals, food banks, faith-based channels, Latino health, and expanded to include seniors in federal fiscal year 2018-19. Community-based organization projects were intended to grow through three phases towards becoming a fully funded CalFresh Healthy Living programmatic intervention. The community-based organization project success hinges on the consistent and trusting relationships that organizations have fostered with us. The Health Ambassador model was an encouraging strategy in these community-led projects. Health ambassadors and community members of all ages stepping into leadership roles to identify community needs and solutions. These are trusted members of communities that can play the role of an advocate, educator, mentor, outreach worker, role model, and interpreter. They have historically played a role in reducing poor health outcomes and increasing wellness in rural and under-resourced communities. Next slide. Community-based organizations had to make changes and adjust their programming during 2020 in the face of multiple public health emergencies, including COVID-19 and the California wildfires. Community-based organizations identified ways to adjust their programming that would work for everyone to allow participants to continue engaging in this SNAP-Ed work. Now, I would like to introduce to you the two organizations, the Latino Coalition for a Healthy California and the California Indian Museum and Cultural Center. I will now pass it to Rosa with Latino Coalition for a Healthy California.
Thank you, Ana, for that introduction. Again, my name is Rosa Flores. I'm very thankful to be sharing the same, albeit virtual, space with you. This afternoon, I'm going to be sharing a bit about our work on transformative community mobilization for healthy food access during COVID-19 and how we were able to achieve this through the Health Ambassadors Initiative. First and foremost, thank you so much to the California Department of Social Services and CalFresh Healthy Living for supporting our work. We certainly couldn't do it without you. Also, thank you to ASNAP for the opportunity to share and Emily for inviting LCHC to participate today. Again, my name is Rosa Flores. My pronouns are she, her, ella, and I am the Senior Programs Manager with the Latino Coalition for a Healthy California. Next slide. Okay. So the broad goals of the initiative, not unlike many SNAP-Ed programs, were and are to create healthier California communities, reduce health inequities, reduce food insecurity in low-income communities, and elevate local community leadership to support well-being during COVID-19. As Anna mentioned, we truly believe that elevating grassroots leadership in communities of color is key in helping us reach these goals. Next slide, please. In a very small nutshell, in 2020, we had the incredible opportunity to work with Líderes Campesinas and the Social Justice Learning Institute to advance policy, systems, environmental change through 21 health ambassadors in the Central Valley and in LA. And the health ambassadors represent different parts of California. In the Central Valley region, we worked with folks from Kern, Fresno, Madera, Huron. In the LA region, we worked with folks from East LA, Southeast LA, Inglewood, Linwood, and the San Gabriel Valley. And I believe it is important to note that the communities we engage, who the communities we engaged with, who they are. And I'd like to highlight that all the ambassadors are from communities of color, non-Black, Latinx women, and Black youth. And it's also important to note that 95% of our ambassadors are parents and are primary caregivers. A large percentage of them are also monolingual Spanish speakers, and 85% of them shared having a mixed status family, meaning that they have family members of different immigration and citizenship statuses. Next slide, please. In order to support the program overview, I categorize the program implementation phases into 3 main components. And in preparation for phase 1, I worked with partners at the County of San Diego to adapt the second edition of the Resident Leadership Academy curriculum for Health Ambassadors 2020. And our staff anticipated tech challenges. We knew that it was important to ensure that each ambassador had a bound hard copy curriculum workbook in either English or Spanish so that they would be able to follow along with our lessons. So we made sure that those were mailed out to everyone. Our staff also created slide decks for each Zoom session. So yes, that means that we created 29 separate slide decks for ambassador learning. Virtual training started in June and ended in August. So I'm sure you can imagine our summer nights and weekends look very different this year. And the way that I like to describe the lessons in the Resident Leadership Academy is it's kind of like a crash course in public health. During training, we learned about and discussed the social determinants of health. We talked about the different components of the food system, the importance of navigating food resources, how land use worked, the importance of understanding our local and regional bodies of government, and the importance of civic engagement. And working on an online platform and offering different ways to connect ensured participation from all 21 of our ambassadors. After phase 1, i.e. training, we began coordinating and preparing for the data collection phase that would help inform the educational meetings that we planned on having. The data was ultimately used to create bilingual one-page educational tools for decision makers. And our ambassadors captured information on a plethora of subjects. So some of them spoke and wrote about how homeless folks were being impacted by food insecurity, how transportation affected access to pantries, the role of mutual aid networks, and so much more. And in a way, I like to say that we really reimagined health education. So then in phase 2, we prepared the health ambassadors to meet with elected decision makers in their region. We ended up meeting with 5 Central Valley City Council members and staffers and 1 LA County supervisor. So we actually met with the Office of Supervisor Holly Mitchell and several mayors and council members across the Central Valley. And my favorite part about this piece were that these meetings were ambassador-led from beginning to end. This means that they introduced themselves, they introduced the issues and the way that they prioritize those issues. They shared all of the data that they collected, they shared their experiences and their challenges. And in phase 3, I'm proud to share that each office requested follow-ups, and the ambassadors are very much looking forward to continuing to work with the offices to make healthy food a reality for all. I do have to add that this phase looked different for each region in terms of how the length of the meetings and the way that additional meetings have been happening since the formal quote unquote end to the program. But we're really looking forward to picking up right where we left off with the decision maker engagement and education and supporting the ambassadors through their PSC changes. Next slide. So we've been very happy and extremely thrilled with the outcomes of the program, but I'm sure you all are curious as far as how we got there. We really had to do the work to re-envision and restructure the program fairly quickly. And I think I attribute this to our staff's deep familiarity with the target population for health ambassadors and also our training background as community organizers. We have to learn how to organize sometimes in crisis mode. And so we took the time to check in with our staff and our partners. Certainly, we had to figure out what working from home for our staff and our regional partners would look like. There were shifting responsibilities in workload, shifting responsibilities at home, and some of our regional partner staff and contracted coordinators were affected by COVID-19. So we had to take the time to figure out how to mitigate those challenges we were faced with. And most importantly, we took extra steps to uncover how COVID-19 was impacting our ambassadors. A lot of our health ambassadors, a large majority of them were essential workers from under-resourced communities. Many of them we found were reliving trauma in different ways. And the pandemic really exacerbated a lot of the socioeconomic challenges we knew existed for ambassadors. We also uncovered and knew we had to work through challenges of different language needs. We understood that there were different levels of formal education and that therefore we would have to get creative on how to conduct our lessons. We understood there were differences in access to technology and that we would probably need to offer support with navigating online learning platforms. And last but certainly not least, we also saw a lot of need for mental health support throughout the program. So we took these issues into consideration and looked for solutions. Next slide, please. So these solutions, are tried and true, and there was also a lot of, this was kind of an uphill battle to mitigate the socioeconomic challenges. In the ways that we could, we ensured to offer fair compensation for the health ambassadors' participation through learning, through their training, and through the meetings that they were having with the decision makers. A lot of our ambassadors received compensation, all of our ambassadors, I'm sorry. To mitigate language needs, it really helped to have bilingual, bicultural implementing staff on board. Everyone on our team is bilingual, and as well as our interns, and that really helped make any of the handouts, any of the lessons, the development of the handouts on the lessons easier. As far as different levels of formal education, we really adopted a popular style of training and discussion. So we learned through activities, we learned through watching videos, we learned through guest speakers on the different topics that were covered in the RLA. And it really makes a difference to have culturally humble staff in this respect as well. When it came to access to technology, we understood that we had to be flexible with the different virtual platforms that we were employing throughout the program. Although we prioritized folks' engagement on Zoom, we also understood that navigating Zoom could present different challenges depending on how comfortable folks are with technology. So we made sure to also offer a lot of our lessons on Facebook Live. Social media seems to be a tool that a lot of folks are more comfortable using, and therefore we ensured that our lessons were, again, taking place on Zoom, but that they were also accessible through Facebook Live. And then for those folks who really didn't feel comfortable using Zoom or Facebook Live, again, we ensured that folks had printed workbooks to be able to work from home and follow along with the different lessons for the day. As far as making sure that folks were comfortable in the online learning platforms, we relied heavily upon the regional coordinators to follow up with the ambassadors and employ different levels of communication so that no one felt left behind in their learning. We employed WhatsApp, Facebook Messenger, and occasionally communicated through phone calls and sometimes even text. And as far as the mental health support, it really took our entire team to understand the different challenges that were faced by each ambassador. And I can't say enough about the importance of the tiered levels of support between LCHC, our regional partners, and the health ambassadors. Next slide, please. All in all, this has been a group effort. LCHC has always seen ourselves as a tool to elevate community voices, and it really, again, takes a team. We couldn't have done this without the support and the trust of the regional partners, the regional coordinators, with the support of CDSS and our technical assistants at CWN. And again, we thank you for the opportunity to share our work. I will hand it off to my colleague, Miki.
Thank you, Rosa. My name is Nicole Myers-Lim, and I'm the Executive Director of the California Indian Museum and Cultural Center. We're located in Northern California, and I come from the Pinalville Pomo Nation, which is one of 24 bands of Pomo that are located in Sonoma, Mendocino, and Lake counties. Next slide. The California Indian Museum has a statewide focus, and our mission is to educate the public about the history, culture, and contemporary life of California Indians from a Native perspective. And the Native perspective is very key in our approach because we focus on museums as a living institution, and the role of the Native perspective is really critical in a culturally sustaining pedagogy that looks at Native cultures as dynamic and shifting and changing and being lived by the members of the culture. Next slide. So our project focused on our tribal youth ambassadors, and they engaged in addressing food sovereignty issues through the YPAR approach, the Youth Participatory Action Research approach. And one of our critical components was we needed to adapt this to be culturally and tribally specific. And in order to do that, we focused on integrating intergenerational learning opportunities and focusing on oral history. And the integration of youth and elders in the project made our project culturally specific, but we also focused on community engagement. And by engaging our tribal community, it really gave them investment, action, and ownership in the project. All too common in tribal communities. I think we're one of the most researched populations around. And a lot of times we don't always see the benefits of that research come back in to support our communities. So active community participation, engagement of elders, and leadership by youth all come together to make it very enriching and powerful for our people. Next slide. The overall focus of our YPAR research projects were to research tribal community access to healthy and traditional foods. And we did this by going through several years where we focused on different elements of that. We first tried to address the gaps and needs in the transmission of cultural knowledge, in addressing how we identify healthy and traditional foods, how we process those foods, how we gather and store those foods. And then in our second year, we really wanted to increase our tribal community members' access to healthy and traditional foods. And we realized that had a lot to do with where those cultural resources are located. While we are multiple tribes in our area, we possess very small amounts of tribal land. So the majority of our cultural resources are on public and private lands. And so we really had to identify strategies for how we increased our access to those areas. And so we really wanted to focus on addressing issues in the third year that were challenges to accessing those lands and strategies and resources to overcome them. Next slide. So we focused on several resources that we created, and one was to create a culturally relevant tribal recipe card. We created a 6th to 9th grade nutrition lesson plan that was place-based. Our tribal youth also had a really innovative idea of coming up with tribal culture cards that are small educational cards that they could take out into the field. And then we also worked with PHI to develop best practices and recommendations for partnering with tribes and tribal organizations. With our recipe cards, we work with one of our elder advisors from the Sherwood Valley Band of Pomo, Lois Fluke, and she works in the elder nutrition program. And we developed recipes for acorn bread and quail stew. And we did some cooking demonstrations on Facebook Live, held some field testing via Zoom within our Tribal Youth Ambassadors group. But unfortunately, because of the limitations of COVID and wildfires, which we also experience in our area, it prevented us from field testing the recipes with our tribal community members. And because we wanted to really keep a trauma-informed approach and make sure that we were addressing community members where they were at and not causing more burden or stress, we decided to delay some of the field testing and evaluation until a time that was more appropriate. So while we will put these resources online, we still have a few steps to complete in that process. Next slide. With our nutrition lesson programming, we really wanted to create a place-based curriculum that would foster respect for tribal ecological knowledge and environmental stewardship by tribes within our own ancestral territories. And so we developed this curriculum and looked at it really as a holistic curriculum, definitely looking at keystone species, cultural and environmental resources, the health benefits of those resources, and then also looking at how active cultural gathering contributes to your physical and mental health as well. And so the lessons were designed to be adaptable so that different regions of tribes in California could adapt them to their own place-based structures. But again, this was another element of our project that needs to be field tested with teachers, and having online distance learning prohibited us from that. So while these lessons will be forthcoming and online, evaluation has to be completed with them. Next slide. The culture card was really innovative, like I said, from our tribal youth. And it came from their own experiences of going out and trying to sustain the transmission of cultural knowledge out in the field while they were gathering and learning with their elders. And so from that experience, they found that many times this process was interrupted by folks who were kind of challenging their actions out in the field or wanted more information. And also there's permitting issues as well that needed to be addressed. With climate change, a lot of times permits are only good for about 24 hours, and it's hard to predict the time that the cultural resources are actually ready, or things can be impacted like air quality and wildfires where you don't have any opportunity to go out and gather. And so the youth wanted to make educational resources for our community that inform them of the best times to gather, what resources are out there, how to identify it, and what the health benefits of those resources are. And one of the nice outcomes of this work was that it inspired our regional Sonoma County parks to really take a look at their gathering policy or lack of. And so they contacted us recently and said that they're drafting a tribal gathering policy and are seeking our input into how overcoming the issues that are experienced by our community. Next slide. So with our strategies, I think that one of the great things is that they reflected the lived experiences of our youth when they were out in the field and experiencing harassment and disruption of their learning. While they wanted to engage in cultural revitalization practices, but were interrupted, they sought strategies to overcome that. And the culture card was a really good result of that. And I think too, we really mobilize positive community feedback and engaging our community, garnering their support for our work, and really helping us move things forward with that support. We also really focused on building infrastructure with PHI and our agency partners and educating them about decolonized research practices and how we could really be collaborative in a positive way that supports both the agency and the tribe, rather than, sometimes where in the past where we've kind of had misinterpretation or wrong assumptions, and we weren't able to overcome those challenges. So I think we really were able to do this project in a positive way. Some of the challenges that we experienced were definitely the restrictions around COVID and the impact that it had around our community and cultural connectivity. Often, we form our community bonds and we engage in learning as a group, and having to do that in a virtual space was new and challenging for us. And as well, we had fire season that lasted a long period of time this year, and multiple fires that really triggered a lot of anxiety and trauma, because we've had several years of fires now and displacement. So we really had to focus on meeting our community where they were at and making sure that we weren't contributing to any further anxiety or trauma. And then the last challenge we had was the engagement of a virtual platform. Because of there's long histories of cultural appropriation and negative interactions with non-Indians who study tribal cultures, we really had to find a way for our community to feel secure to share cultural information and exchange cultural information. And so we engaged a platform that was built purposely for tribes, called Mukadu, which makes the digital and virtual content very secure. And that way our community felt safe in opening up and sharing information. Next slide. Our best practices really looked at integrating that intergenerational learning opportunity and engaging the feedback. And one of the things that we experienced was the need for technical and equipment support to really keep our elders engaged and involved. We saw that that was going to be difficult with a virtual platform. So sometimes it just took sending our staff out to elders' homes, making sure that they were socially distanced and had the proper PPP, and going out and providing those resources and hooking up cameras and making sure that the laptops were working, and iPads and things of that nature. The decolonizing research practices really have to be central to tribal research projects so that the interactions and collaborative approaches can be positive. And one of the issues that tribes often face is they feel that often we're in one-way relationships, because often the tribe is trying to teach the agency or the non-Indian partners about our history and our contemporary issues, and it takes a lot of energy and effort just to get on the same page. And so where we can create reciprocity in those relationships is really key to success. And then lastly, it's really important that we have a trauma-informed approach. Our communities suffer with historical trauma. And then when we have crisis happen on top of that, we really have to be sure that we're being adaptive and flexible. While we might have timelines and deliverables that have to be met, we also have to be sure that we're doing that in a way that's appropriate and going to generate the best outcome for everybody involved. So thank you for the opportunity to share this information with you. Next slide. This is our contact information at the museum. Feel free to reach out to us if we can be of any assistance, and I'll pass it on to Emily.
Thank you, Nikki. I'm so grateful to be here today to share about the experiences working in concert with these two incredible organizations. My name is Emily McClintock, and I am a research associate with the Public Health Institute Center for Wellness and Nutrition, or CWN. First, I'll give a bit of context about who we are and what our role is in the CDSS CBO projects. The CWN works in partnership with CDSS and the CBOs to support community-driven approaches to meeting community needs. CWN provides training and technical support as well as evaluation support to align projects' efforts with SNAP-Ed goals and guidance. We promote evidence-based community-driven practices and share tools and resources to support equitable practices and outcomes. I will be sharing some of the key lessons learned and takeaways from working with CBOs during this year full of public health emergencies. Next slide. In both projects, there was a benefit to having multi-generational programming. For example, the pairing of youth leaders with community elders was a critically important component for building out the Tribal Youth Ambassadors YPAR project that Dr. Lim mentioned earlier. Community elders supported and encouraged the youth leaders, and the youth used the elders' teachings to inform their work toward identifying appropriate PSCs for their communities. In this case, the multi-generational approach was aligned with cultural practices and contributed to the project's success. Furthermore, multi-generational approaches and the use of YPAR or PAR practices may be a useful framework to consider for future collaborations between Native communities and CalFresh Healthy Living. Multiple channels for project delivery were tested and used to maintain connection with program participants throughout the project this year. Flexibility to the unique needs of communities was key. Both programs adjusted as needed along the way, meeting participants where they are to ensure community engagement. This not only makes the project equitably accessible, but also keeps the project moving along and able to continue during emergencies. In addition, there were actually benefits identified through virtual programming this year. Youth ambassadors had more consistent participation with Zoom meetings since travel proved challenging in previous years, particularly for those in rural communities. Similarly, LCHC health ambassadors were able to participate on their own time, which no longer conflicted with work, childcare, or challenges with travel. In addition, providing fair compensation to ambassadors supported project participation and retention and helped ambassadors and organizations with their needs during the pandemic. Next slide. In the case of LCHC, to center the voices of those most impacted by health inequity in the work to mitigate food insecurity, bilingual and bicultural community programming that elevated the needs of non-Black Latino and Black caretakers and parents in SNAP-Ed eligible communities was critical. Close community ties and cultural understanding in the case of CIMCC ensured that communication was strong throughout the project and ultimately built a community for participants and staff within the projects themselves. Next slide. Participatory research methods and material developed this year laid the foundation to develop and implement impactful PSC changes. For LCHC, the use of photo voice gave health ambassadors evidence to support the needed systems and environmental changes for their communities. With CIMCC, there is a foundation of research that youth have built that identified the need for educational materials before the implementation of community change approaches. The culture cards and recipe cards serve as important components in tribal and non-tribal education. Moving forward, CIMCC and tribal youth ambassadors can start the process of implementing systems and policy changes that will allow CIMCC to serve as an intermediary between private and public agencies and tribal community gatherers, harvesters, and traditional food advocates. PSCs can provide critical changes that may increase equitable access to resources, including healthy foods, but they must have good evidence and community buy-in, and community members are the best positioned to determine what PSCs will have the largest impact. Next slide. Collaborating with community organization leaders and local researchers to identify the best approaches for evaluation is critical. Working closely with the CBOs on building evaluation plans, identifying key and appropriate indicators, and optimal methods was critically important for evaluating the success of these projects and maintaining positive community relationships. Collaboration with communities at every stage of evaluation is crucial in gathering accurate and authentic feedback. Particularly for Native communities, it is recommended that well-informed SNAP-Ed implementers and educators collaborate with Native researchers and community members to evaluate the materials and determine the materials' utility and accuracy for communities. Furthermore, wherever possible, members of Native communities should be asked to lead or assist with collecting the feedback. This rings true for other communities as well. Bottom line, collaborate with community and local researchers where possible. Next slide. And finally, without either of these CBOs who know their communities so well and have deep cultural and historical connections to them, the work would have stopped once emergencies hit. But instead, because California is investing in building trusting and lasting relationships with community-based organizations like these, the work was able to continue and to continue being a resource to the communities that needed it. None of the lessons we learned through adaptation would have come as easy as they did through government partnership alone. These CBOs were the key. And thanks to CDSS for having the vision for this connection and to have had these partnerships established well before emergencies hit. And I will pass it back to Anna for a wrap up.
Thank you, Emily. So future direction. We want to leave you with these key points. Community-based organizations are trusted members of their communities and know firsthand the needs of their communities, making these projects much more resilient in the face of continued and emergency public health emergencies. Compensate fairly to deliver SNAP-Ed services to create sustainable projects supporting socioeconomic growth in under-resourced communities. Collaborate with local Native researchers to develop appropriate project evaluations that align with the SNAP-Ed evaluation framework. These are points that were discussed previously, but we want to make sure that these they're top in your memory. Be flexible and adaptive to meet community members where they are at. And CDSS is committed to integrating trauma-informed approaches into the SNAP-Ed work. Additionally, CDSS is committed in supporting community-based organizational work by providing resources and technical assistance to ensure community-centered programming, decolonized evaluation methods, and sustainable community change. We believe that community change is sustainable when implemented on the grassroots level by engaging the gatekeepers of the communities. I would like to thank the Public Health Institute, the Center for Wellness and Nutrition, the California Indian Museum and Cultural Center, and the Latino Coalition for a Healthy California. At this point, we would like to open it up to questions and answers. Thank you.